We've all seen him. Maybe he's your father, your brother, your husband, or your closest friend. Maybe he's the person looking back at you in the mirror. He is the guy who never gets sick. The guy who shrugs off a sharp pain in his chest as just indigestion. The guy who says he'll get it checked later. The guy who, when asked how he's doing, always replies with a stoic, automatic, "I'm fine." But behind that, "I'm fine," is a quiet crisis. As we step into June 2026, we are forced to confront a reality we still don't talk about enough. Across the world, men are dying younger than they should. And in many cases, it isn't because help doesn't exist. It's because too many men have been taught to suffer in silence. Today, we need to talk about why men die sooner, the hard numbers behind the heartbreak, and how the theme of this year's Men's Health Month, Partners in Care, might genuinely save lives. Let's start with the data, because numbers don't lie, even when society tries to look away. Globally, women outlive men by roughly 5 years on average. In some countries, that gap grows even wider. And no, this is not just biology. Genetics play a role, but lifestyle, culture, stress, and silence play an even bigger one. The 3 leading causes of death among men continue to be cardiovascular disease, cancer, and unintentional injuries. Take heart disease. 1 in every 4 male deaths is due to heart disease. Think about that for a moment. 1 in 4. And what makes it even more terrifying is that many men who suffer fatal heart attacks never saw it coming. Half of the men who die suddenly from coronary heart disease showed no previous symptoms. They felt normal. They went to work. They answered emails. They joked with friends. And then suddenly, they were gone. A few years ago, a man named David, a 52-year-old father of 2, began feeling pressure in his chest whenever he climbed stairs. He ignored it for months because he was busy working overtime and supporting his family. He kept saying it was stress. One morning, while driving to work, he suffered a massive heart attack. He survived, barely. Later, his doctor told him something devastating. If you had come in 6 months earlier, this could have been almost completely prevented. That story is not rare. It happens every single day. Then there is cancer. Prostate cancer will affect roughly 1 in 8 men during their lifetime. Colorectal cancer is also rising rapidly among younger adults, especially under the age of 50. Yet despite these risks, men consistently visit doctors at much lower rates than women. According to public health data, more than 60% of men skip annual checkups. Many openly admit they only see a doctor when symptoms become impossible to ignore. We are treating our bodies like old cars, driving them until smoke pours out of the hood instead of bringing them in for routine maintenance. And the cost of that mindset is enormous, because early detection changes everything. Caught early, the 5-year survival rate for prostate cancer is nearly 99%. But caught late, the odds become far more dangerous, and that's the tragedy. Many men are not dying because diseases are untreatable. They are dying because they waited too long. But if physical health is one battlefield, mental health is another war entirely. And this is the part of the conversation many people still avoid. Globally, women are diagnosed with depression and anxiety at higher rates than men. But look at the outcome. Men account for roughly 75% of suicide deaths in many countries. 3 out of every 4. Let that sink in. Why? Because society has spent generations teaching men that vulnerability is weakness. From childhood, boys hear phrases like, "Man up," "Don't cry," "Handle it yourself," "Be strong." But somewhere along the way, many men learned that being strong meant staying silent. And silence can become deadly. When women experience emotional distress, they are statistically more likely to seek support, speak openly, or reach out for help. Men often do the opposite. Depression in men doesn't always look like sadness. Sometimes it looks like anger. Sometimes it looks like emotional numbness. Sometimes it looks like alcohol abuse, isolation, burnout, or working non-stop just to avoid being alone with their thoughts. Think about the last time a man in your life said he was Just tired? Was he physically exhausted? Or was he mentally drowning? Older men face an even harsher reality. Research consistently shows that elderly men, especially those over 80, face some of the highest suicide rates of any demographic group, driven by isolation, chronic illness, grief, and loss of purpose. We are losing fathers, brothers, husbands, and sons, not simply because help is unavailable, but because too many have been conditioned to believe that asking for help makes them less of a man. And this brings us to the core message of Men's Health Month 2026. This year's theme is Partners in Care for Better Lifespans Across the Lifespan. And honestly, this theme matters, because a man's health is not just his personal issue. When a man dies prematurely, the damage spreads outward. A child loses a father, a partner loses their teammate, parents lose a son, communities lose leaders, workers, mentors, and friends. Health is never isolated. That's why Partners in Care is such an important idea. It means we stop expecting men to fight every battle alone. If you are a spouse, a sibling, a friend, or a co-worker watching this, you are part of the solution. Sometimes support is not dramatic. Sometimes it's simple. Hey, I booked my health checkup today. Want to book yours too? You've seemed stressed lately. Want to talk? You don't have to carry everything alone. Small conversations can save lives. And if you are a man listening to this right now, hear this clearly. Taking care of your health is not selfish. It is one of the most responsible things you can do for the people who love you. So let's talk about what action actually looks like. Not next year, not someday. Now. Step 1. Know your numbers. Get your blood pressure, cholesterol, blood sugar, and weight checked regularly. High blood pressure is called the silent killer for a reason. You can feel perfectly healthy while serious damage is happening internally. Step 2. Understand your screening timeline. If you are over 45 or younger with family history risks, talk to your doctor about prostate and colorectal cancer screenings, because prevention is always easier than emergency treatment. Step 3. Prioritize sleep and recovery. Many men brag about surviving on 4 or 5 hours of sleep like it's a badge of honor. It's not. Chronic sleep deprivation increases stress hormones, damages heart health, affects testosterone levels, weakens immunity, and raises the risk of depression and anxiety. Your body cannot heal if it never truly rests. Step 4. Move your body. You do not need to become a marathon runner, but your heart was designed to move. Even 30 minutes of walking a day can lower stress, improve cardiovascular health, improve mood, and reduce long-term disease risk. And finally, step 5. Talk. Talk before stress becomes isolation. Talk before isolation becomes hopelessness. One honest conversation can interrupt months of silent suffering. On Friday, June 19th, people around the world will participate in Wear Blue Day for Men's Health Month. Wear blue. Start conversations, share information, encourage checkups. But more importantly, look out for each other beyond one day. Because this issue is bigger than a hashtag. This is about lifespan. This is about fathers seeing their children grow up. This is about men reaching old age with health, dignity, and purpose instead of regret. Real strength is not pretending nothing hurts. Real strength is saying, I want to be here for the long haul. I want more years with the people I love. And that means I need to start taking care of myself now, not later. This June, let's stop glorifying silent suffering. Book the appointment. Answer the message. Check on your brother. Listen to your father. Talk to your friend. And if this message resonated with you, share it with a man you care about. Because sometimes a conversation arrives before a crisis does. Stay healthy, stay strong, and I'll see you in the next video.